Insertion of an intraocular lens is the most commonly performed eye surgical procedure. We spoke with Dr. Diana Kersten of Harvard Eye Associates to learn about intraocular contact lenses. Who are the best candidates and how is the ICL implant inserted?
The intraocular contact lens corrects patients who are too nearsighted to have LASIK. In fact, the bulk of the first patients having it done are those patients who've wanted something for years but couldn't have LASIK because they're too nearsighted or their corneas were too thin. So that's one of the advantages. The other advantage is that you're not removing any tissue from the patient's eye. You're simply inserting a very thin contact lens into the eye, behind the pupil but in front of the patient's natural lens. That implant can be removed later. If a bifocal intraocular contact lens comes out in 10 years, you could have your current lens removed and the new one inserted. LASIK has trouble with dry eyes, especially in a dry place like Southern California. The intraocular contact lens does not cause dry eyes at all. And it seems in most of the studies that the clarity and the sharpness of the vision, especially for the more nearsighted people, is better with the intraocular contact lens.
Implantable contact lenses are lenses designed to replace the glasses or contact lens power inside the eye, and at this point are mostly used for people who are not good candidates for LASIK surgery or other laser correction. Implantable contact lenses provide a very high definition detail vision that sometimes lasers can't for people who are extremely nearsighted or possibly those who are farsighted in the not too distant future. Implantable contact lenses work by taking the spectacle or contact lens prescription that a person has and putting it inside the eye. So it's like having a contact lens that you never need to think about, constantly working and allowing the eye's natural lens of a young person to focus far and near for reading and distance without glasses. Because it's a type of lens implant and it is placed inside the eye like a contact lens, but inside, it can actually be removed and replaced later if the eye should change or the future should bring some difference in vision. And it's very gratifying to see these lenses work in our patients. We now see people who come in just a few days after surgery who'd been told before, sometimes several times, that they're not a candidate for any procedure. And to see them come in and have a new perspective on the world, it's just very gratifying.
What I love about the intraocular contact lens is the clarity and the precision of it. It's optically an excellent lens with exceptionally clear vision. This is what the intraocular contact lens looks like. The optic is the central round part and it's extremely thin. It's only 50 microns in thickness, and it fits right in front of your natural crystalline lens. It's vaulted so that the lens itself, the contact lens, does not touch your natural crystalline lens. The front of the eye has been filled with a kind of a gel, and that helps the implant to unfurl very, very slowly. And basically, as you see here, small openings made into the peripheral part of the eye. This is exactly the same incision we make for cataract surgery. And it is a self-sealing incision, so there's no sutures or irritation from this incision. This shows the implant being inserted. The implant rolls up into a very small tube that goes into this 3mm incision, and it unfolds very slowly. And the implant has these little tabs. It has 4 tabs, and the surgeon tucks those tabs under the iris. First, some gel is put in the front of the eye to lower the implant down more towards the plane that we want to have it at. And next you'll see the haptics, or those small tabs placed under the iris. So here the tabs are being placed under the iris. And once the lens is inserted, a solution's put in to make the gel come out of the eye, and then Myocol is injected. This is a solution that makes the pupil constrict. And the procedure is essentially finished.